Data shows that Black women are in crisis when it comes to maternal health. And according to the CDC, Black women are nearly 3 times more likely to die from pregnancy-related causes than white women. And in Missouri, that rate is even higher. So joining me is Rose Anderson-Rice from GenerateHealth. Thank you for being here.
Thank you so much for this opportunity.
Your work is so important. What is driving the crisis here?
There's a lot happening, and as you shared, the state of Missouri has worse maternal health mortality, and lots of things are driving this. There are, access to care is a barrier, not listening to women, and this is women in general, and especially Black women. Mental health services and mental health issues are also driving this, and hypertension. So not all individual behavior, but things that can be prevented within the healthcare system.
I think when Serena Williams went public about her experience, that really opened a lot of conversations for people, because women, Black women, women of color are often not heard in the delivery room when they know something's going wrong with their bodies.
Absolutely,
right?
And if they're listened to, sometimes that care is delayed and we need immediate intervention. And you're right, it's unfortunate that education nor financial means are protective factors for Black women.
Right, right. What are some of the real issues that Black women face when they're pregnant, by the way?
There are all kinds of things that are happening, and this campaign that we're launching, we really are trying to help folks understand the urgent warning signs, like if you see the mom or the pregnant person's legs swelling or face and hands swelling, or if there's bleeding and discharge, that they get to the hospital system as soon as possible so that they have a better chance of getting the care that they need.
Yeah. Now, we said 75% of these deaths are preventable, so how is your work trying to change that?
So we are convening both healthcare providers, community-based organizations, and more importantly, centering folks who have lived experience, folks who have unfortunately had issues in complications in pregnancy. And it's supposed to be a happy time for families. And we are collecting stories, because with those stories are able to empower and help folks understand this issue better. And we want to hear these stories, not just from the birthing person, but also dads and aunts and uncles and family members, because behind these statistics, although we're saying the numbers, behind these statistics are real people. It's moms and babies and families and our community.
And you have to get the village involved, right? If you want to be advocates for the child and for the mother, of course.
Yes, absolutely.
Do you find that the conversations are more open now? Do you think that people are starting to listen, or do you still feel like you've got a lot of headway to make?
I feel like there's more work to be done, for sure. And having an opportunity like this to even talk about this. So our To Be Heard campaign is really to give voice to folks who are going through this, to collect their stories, to also build awareness around this issue, because I think we just take it in as if it's our family. It's just affecting us. And we had an event in June called Her Health, Our Future, and this is important. Maternal health is important to our community.
Absolutely. Oh my gosh. Mothers, Black women, rule the world. You know what I mean?
It.
We really are the heart of our community. So I'm wondering too, how can people get in touch and be a part of Be Heard? How can they get in touch with you?
Thank you so much for offering that up. We want folks to reach out. We also want to partner with people. We want to collaborate with other organizations, with community members, with churches, and you can visit our website, www.generatehealth.stl/To Be Heard. And on that page, you can get all types of resources. We also have a guide, Know Your Power. So if there's a pregnant mom who wants to know what kind of questions should I ask my OBGYN, we have those resources on the website. And we always need people to donate. That's going to help us move our work forward. Absolutely.
Put your money where your mouth is.
Let's
spend that money.
There you go.
If there's one thing that you want people to take away from all the work that you're doing, what would it be?
I think you hit the nail on the head when you said it takes a village. And none of this work can be done in a silo. We really need collective effort. And so our organization is convening folks locally, regionally, and then with impacts that happen at the state level. So we want folks to understand that this is our issue, that moms thriving, babies thriving, lead to thriving communities. And that's what we want.
Absolutely.
Everybody wants that. And everybody has a right to that.
Yes. We were just talking about that yesterday. How do you look at healthcare? How do you look at food and shelter? Are these basic human rights?
Absolutely.
Yes.
Absolutely. Not handouts. Basic human rights.
Yeah, and our community thanks you for all that you're doing.
Thank you, Michelle.
And also, yeah, let's make some changes together.
Yes, we'd love to come back and talk about it.
Yes,
we
you're
want to talk
welcome
about it on
anytime.
the other side. We want things to be better, and we come back and celebrate those wins.
Absolutely. Okay, we'll come back.
Yes.
Thank you so much.
Thank you.